This is new at 4. Tonight, the Oregon Nurses Association is calling for the removal of several health officials in the Multnomah County Jail. The nurses citing serious health care and operational issues, including several inmate deaths. Good afternoon. Thanks so much for joining us for KT News at 4. I'm Deborah Knapp.
And I'm Ray Gasway. Within the last 2 months, 97% of nurses in the union voted they have no confidence in leadership at the Multnomah County jails. Today, we're on your side digging into what led to that result. Katu's Emily Gersh spoke with one of the nurses in the union. She's tracking this story from the live desk. Emily, what happened today?
Yeah, Devin, right. Well, the nurse I talked to said the nurses who work at county corrections requested to speak at the county board meeting today, and they were denied. So that's when they decided to publicize that no confidence vote.
And I think that the nurses have just said enough is enough. We're tired of the neglect.
Pauline Sinclair is one of more than 60 nurses who work in Multnomah County Corrections. She and her colleagues are calling for the immediate termination of the director and the senior clinical manager. In an 8-page letter to county leaders, the nurses claim Corrections Health Director Michael Obiero failed to adequately staff the correctional facilities, left in the midst of a crisis in inmate deaths, created a hostile work environment, and ignored staff concerns over working conditions. K2 News has been tracking the inmate deaths at the jail. There were 7 deaths in 2023. 3 were by suicide and 2 were by fentanyl overdoses. Data from the jail shows there were no deaths in 2020 or 2021. There were 3 in 2022.
We are right up there with Rikers Island as far as the number of deaths in a jail in 1 year.
In response to the letter, Multnomah County Chair Jessica Vega Peterson sent a statement to K2 News saying she has asked to meet with the nurses several times since their last communication on April 9th, but they've declined. She also said there have been 14 new hires and 15 new rehires to address gaps in staffing. A representative for the nurses union said union leaders were unable to make the meeting date the chair requested. And as far as staffing, Sinclair says the numbers the chair provided aren't accurate.
We have 12 empty positions and an additional 17 empty positions for nurses, and we are nowhere near have we had that many hires.
Now, just in the last half an hour, I got a response from a county spokesperson. They stood by the hiring numbers the chair reported. They also attached emails between the county and the nurses union showing that the union was denied time to speak before the board today for timing purposes. I also got some insight into their plan to meet again in the future. I'll be digging into those details on a digital edition of K2 News at 5 o'clock after the draft. At the live desk, Emily Gersh, K2 News.
Emily, thank you.